Get informed on what is happening in our political scenes and people who are making headlines in different parts of the country and the world, right here at TAS TV. Join me, Lavin Nyagoa, as I bring to you weekly news highlights that are factual every Friday at 4 o'clock. See you then. Good afternoon, good evening. It's another beautiful Wednesday that you get to meet here again. Remember, when you see me every Wednesdays, it's time for counting the red ribbons, where we celebrate milestones of persons living with HIV and AIDS and basically just create awareness on the same. And on today's episode, there is no much difference. So the topic of the day is HIV and mental health, and we just want to explore the relationship between these two, looking at the aspects of stigma, treatment, support systems, and all the need for holistic approach to healthcare. Just looking at all that, and as always, I have an amazing guest with me in studio who's going to be helping me dive into that topic. But before we get to see our guest, or rather let him introduce himself, I just want to let you know that this episode is courtesy of the Smart Shopper. Remember to check out their products that range from jewelry all the way to home decor, depending on that which you want for your specific need. Call the number 0798154042 to make your order. And in case you are in Thika Town, you can always step to Nema Plaza, second floor at Tante Africa Studios. You'll get Virginia at the reception waiting to serve you, because customer service is their number one priority. Away from that, and without so much talking, allow me to go straight into letting my guest introduce himself. Karibu sana.
Thank you so much.
Please introduce yourself.
My name is Griffin Lenane. I'm the project coordinator at Gates of Hope on mental health project that is running for the past 1 year. And this is a project that was funded by USAID through partnership with the Kenyatta University as well as Yale East Africa. Therefore, us, we actually are based in Kiganjo, Makwengeni, Kona 2, and we're actually doing this to support youth with the disability as well as just the general youth population. Interesting.
So today our main focus is on HIV and mental health, and of course, as a practitioner or as an expert, of course, we may interact na all these people. So maybe just to start us off, I'd love to know, or rather let our audience know, the difference, or rather the relationship between these two, HIV and mental health.
Well, thank you so much. There's a very, we'll say there's a very big relationship or nexus between HIV and mental health. Why? HIV, it is a viral disease, but again, it does not kill. But it's a situation, it's a condition that an individual who contacts the virus will live with it for the rest of her life or his life. Yeah. That is if there's adherence. At the same time, mental health is just a disturbance of psychological it's not really lack of diseases, but it is that state of being psychologically disturbed, mentally disturbed, emotionally disturbed, other than just physical disturbance of the body. So the two intertwine in a way that when someone is HIV positive, then his mental health status is disturbed, because one, there are some of the impediments, or rather the bottlenecks that he actually or she is actually able to face, which will actually make them not to live a normal life, because they're being disturbed in the mind. For instance, we have the stigma, we have this. And you talk about stigma, this self-stigma. You stigmatize yourself, you start secluding yourself, you feel like you are not part of the person you used to be. Something is happening with yourself. So unless now you realize what's happening, and through the system, the support system that within, then you're able to deal with this stigma. And at the end of the day, you accept yourself. Then of course you start living a normal life. When you actually start taking medicine, you actually accept, agree that I need to take medicine. then there's more to life than just the condition which you're prevailing in your life.
Interesting. So what would you say are some of the psychological changes that somebody who's just been diagnosed with HIV and AIDS is likely to face along the way?
Well, first and foremost, we call it denial. The first thing you realize, just the mere sense that you have a terminal disease, because HIV does not kill, but well taken care of, you live with it forever. And that means there are things you need to do. You used to drink, now you stop drinking.
Yeah.
There are things you used to do, when you do them at the moment, they start affecting your life.
Yeah.
That one start working, it start disturbing your mind.
Yes.
And therefore, unless you reach a profession, a mental health profession, or we call them the counselors, then it means you might not be able to handle the situation because, first of all, you are denying you have it. And another thing, you lack sleep. You actually get stressed. The stress is part of is mental health disorder.
Yeah.
You actually, you start being anxious. What's going to happen? What are people going to talk about me?
Yeah.
What are people going to talk about? What's my girlfriend going to talk about? All those things.
Yeah.
And also, those stress, anxiety, and depression is actually signs of mental health disorder. So there's a very big nexus between mental health
and HIV and AIDS. Interesting.
Yeah.
So earlier in the conversation, you've talked about stigma and discrimination, and of course these two have such a major role to play when it comes to HIV. Joe, you've mentioned something to do with self-stigma, and there's also the stigma that comes with the community and people who are around you. So how then do we make sure that the society works towards just ensuring that they get to reduce this burden?
Well, we'll say, yes, it's a good question.
Yeah.
But again, it takes efforts of the whole community. One, stigma comes as a social fabric.
Yeah.
You might go, like in the West, it is there, but it's so minimized. They tend to approach stigma in a way that does not really, blackmail someone. But now in African context, stigma first begins from the social beliefs in the community, or the attitudes. People have attitude towards a given thing, or towards a given disease, or towards a given person, and therefore you realize with other issues that come in, like HIV. The stigma now goes further to see, for instance, let me use, if it's a lady that has HIV, the first thing you see at that lady, you see that this lady has been going out. For lack of a better word, she's a prostitute.
Exactly.
You see? So you see, she's fighting a cultural belief which is actually embedded in a stigmatized kind of way.
Yeah.
So I think the best way to handle this stigma is actually purely sensitizing the community, and letting them understand that anyone can get HIV.
Can get HIV.
Anyone can get mental health. It does not choose.
Yeah.
It does not choose. And most cases, all the cases of HIV that I've worked with, most cases people will tell you, I did not get, it was not intentional.
Yeah.
Yeah. It was just by sheer coincidence. Someone walked out, or you decided, let me just try it. Without intention, then you actually get the HIV. But now what do? There's more life than just HIV. The most important is to accept it, deal with the community to accept the availability of stigma. Yeah. And how to deal with it by actually sensitization, continuous sensitization. And I want to thank the government, also the community. There are those communities who have, we have the specialists in mental health. Yeah. We have the peer educators. We have the community promoters, health promoters. Those are people who are actually on the ground with the people. And those are people who should be empowered so much, so that because they know the household, they know the kind of diseases these households suffer. Yes. Therefore, those are the people who need to be empowered by the government to be able to visit this household, provide the necessary services, ensure there's adherence, ensure there's no missed appointment, ensure that they take medicine, and ensure the viral load is suppressed. As well, try to be empowered to identify this kind of issues in the community, so they actually help this person link. Just beside providing the basic services, they also link these people to health facility, so that they can get the help that they need.
Okay. Yeah. So away from that, earlier Tukirudi hapo nyuma kidogo, there's the aspect of the psychological torture that comes with, you know, when you're immediately diagnosed with HIV and AIDS. And now this impact, how then does it affect the ability of individuals to actually go and seek medical attention?
Thank you. One, let me take for example.
Yeah.
Personally, I do peer educate. I'm a peer educator.
Yeah.
I like working with the youth, and HIV and mental health has been like what I eat, what I sleep.
Yeah.
Now imagine within a given area, I find myself with HIV. Of course, there's that data. Anyone who is there are those CC facilities within the community, right?
Yeah.
Where this individual go to take the medicine. Yeah. So the first thing that I'm diagnosed with HIV, one thing that will disturb me: where am I going to seek medical attention?
Medical attention.
Because I will not be able to go to the facility that know Griffin. I'll actually go to facilities that are far away from Griffin.
Yeah.
Do not know Griffin, and more often than not, that's what people do. A person lives in Makongeni, but where does he take his medicine? He takes medicine from town, from Kibera, from Mombasa Road, because he fears those who are providing, dispensing those medicine will actually talk about him.
Yeah.
Or probably I'm going to meet another Griffin or
another person
who knows me.
Yeah.
I'm taking me. So at the end of the day, we know each other, yes, we have an agenda, but I fear you talk about me and I'll talk about. So that will actually make me fast. By the time I'm going to pick medicine or to start accepting, to go into the system of ART, it takes much time because first of all, I'm finding there's a lot of impediment of me going. I don't know where to go. I don't know what to go about. So it will deter me from seeking medical attention as far as medication is concerned.
It's concerned. So my question would be, so what are some of the strategies that are being employed just to make sure that this concern is actually dealt with? Because it's not an interesting way to say that you have a facility that is close to you, but then you go far away to seek the same service that unaweza pata karibu nawe.
That's true. One is to normally one of the strategies I've seen the government has employed, and of course indeed the partners who are dealing with the HIV is to when the child or when the person who's let me not call it the victim, but when the patient is still young, below 12 years, is escorted by the community health volunteers, caregivers, and the partner and the guardian. They're escorted to the facility so that should there be any other questions, it is him who will tackle the questions. The only thing is that the child should go there because before you take him, before you're given medicine, you need to know your viral status, if it's how many viruses are in the body, so that they know which regimes of medicine you need to be given. So one is to be escorted by the caregiver, community health volunteers or CHPs, as well as the guardian. Second, I prefer the best also is for those who are in school. You know, again, another issue that create a lot of non-adherence among the adolescents and the youth. When they go to school, they are judged by their fellow students.
Exactly.
So the only thing, and even their teachers. So the best thing is to actually train teachers, bring teachers into the equation, so that the parents, the child, and the patient, and they can agree. You'll be the one to keep this medicine. So my child be coming to pick, just take. Because sometimes there are those who take once a day or twice a day. Depend on the vulnerability. But I would prefer the teachers are trained to be part and parcel of the process, so that when the parents has the medicine, he gives the teacher, especially during the school days, so that the child or the patient can be going to the teachers to get the medicine. Because again, this comes in, you know, in school, everyone is free. You want to see your box, what is in your locker, what is. So they ask you, why do you take medicine every day? Nini unakunywa kila siku. You see, so that one already is stigmatizing me. Because the people say, so unless if you're smart, as I've had other youth say, they say they have issues, they have underlying issue, the blood sugar, so they take away. You see, but people right there, you just take a bit photo and see what kind of medicine I'm taking. So the most important is just to ensure that the teachers are also brought into the equation, so they facilitate the process seamlessly, and also reduce this time the essence of stigma. Okay,
so what are the implications that are being put in place? For instance, you've mentioned schools, and I talk about schools because they're the very critical space spaces that people get to find themselves into, sindio?
Right.
So we have a circumstance where there is the student anakuwa stigmatized by the teacher. Now this teacher ends up letting every other student in the school know that huyu anakuanga hivi.
Exactly.
Or rather, when you are in the midst of people, they keep shouting at you, umemeza dawa, and all those sorts of things. So what are the implications that are put to actually curb this kind of behaviors?
One, I would say, I don't know, but I don't know if most organizations or schools have put it in place, but I would say we have support groups. We need to have support groups or student right clubs.
Yeah.
And through those student right clubs, they are able to have drug buddies. I take drug, you take drugs. So our time of taking drugs is actually at 7 before we eat. So we remind each other. Second thing, we have, sometimes you can forget. So we also ensure that this child, if he's a forgetful person, he has a watch. Yeah, so he puts a watch. The watch will keep reminding, at 7 you need to take medicine. At 1, you need to take medicine. At 7 in the evening before you go to class, you need to take medicine. So those are some strategies. And also support groups. Mentorship groups, where we can also, within that mentorship group, we can also have small support groups, whereby we sensitize each other. Because we realize it's not a one-person agenda.
Yeah.
And if you let it have one-person agenda, then definitely will not realize the adherence that we actually looking at. So teachers also I'll go back to the teachers.
Yeah.
Teachers means a lot to these students. And if actually we can sit down and censor the teachers, as well as the leadership of the teachers, that we have 3 or 10 students within the school who are living this way, and is the best way to approach them. Then of course the parents and the teachers can create a good rapport. Yeah. Call the teacher in the evening, tell, give him support, take medicine, please remind him. Then the teacher also takes upon himself. And of course, when the teacher and the student have a good relationship, this student do not feel ashamed to go and take medicine. Yeah. And neither will the teacher feel obligated to judge the student.
Okay. And also feel like there is no need to feel ashamed, because some of them were born with it.
That's
and it
right.
is not your wish to actually find yourself in a situation like that. So again, it's upon the people who are around you to make sure that at every moment they get to support you.
Yes.
Interesting. So we have support groups. You've mentioned support groups. How then do communities contribute to building this kind of groups, just to make sure that they support one another throughout?
Well, true. But more often than not, we realize they're partners. The implementing partners are the one who emphasize. The support groups are there, but I can assure you, because of the stigma, because of the judgment, it does not function well. But through implementing partners, like we have the USAID, we have those implementing partners that support HIV/AIDS initiatives. They actually emphasize on support groups, emphasize on safe spaces, emphasize also drug buddies. Of course, we have the triple zero, just to ensure that the essence of viral load is suppressed and it's undetectable, so that again these young people are able to live a good life. So yes, we agree they're there, but this is a partnership initiative, not actually a community. But once, as well as I would say, since it's also being implemented in the community, those who are being engaged, when the partner leaves, and then you realize actually, yes, the community is actually trying to see the importance. Because at the end of the day, we actually trying to realize that we are trying to put our effort together to ensure that all those people live with HIV, their viral load is suppressed, so that they're able to protect against opportunistic diseases, and they're able to live a prolonged life.
Interesting. So guys, we are talking about HIV and mental health, and in case you're joining us just now, we've tackled a few parts. We've talked about stigma, we've talked about discrimination, we've talked a little bit about support systems, and also treatment kidogo too. But right about now, we head on a very short commercial break. When we come back, we are going to be handling more of that. So just so you get to understand the relationship between HIV and mental health, so that the next time you meet somebody in such kind of a space or in such a situation, you will take it up to you to make sure that they are okay and they feel safe in your spaces. See you in a bit.
Sure.
Katika kipindi tunakuletea wasanii.
What's up my guys, I go by the name Rainams.
Eti nikipita kwa macho na nipimia, na kama sina pesa unguwezi nipimia. Hapa Shenster the Poet manze.
Ngoma moto moto.
If you wanna show some love, I don't fake it. Enda kumenya mawazo makuu na nienedera shule warutani waku
Vichekesho mkisongaza. Mahojiano moto moto, stori za wasanii pamoja na talanta za wasanii.
Fiki wa kasi gani kama wapatikani wakati wa shida.
Na pia kwenye kipindi utabambika, utajijenga, utaelimika, utakuza talanta yako.
My name is Rebecca Mutie, I'm a model and I'm Afri Kenya. I'm a student. Napenda kusikiza kipindi cha Bonga na Katoni kila Jumatatu kuanzia saa 9 mpaka saa 10.
Kumbuka ni kwenye Bonga na Katoni ndani ya TAS TV kuanzia saa 9 hadi saa 10 kila siku ya Jumatatu.
This is Bonga na Katoni in TAS TV. Karibuni.
Welcome back, guys. Thank you so much for choosing us, for staying put, for making sure that we're here. You get to understand what we are talking about and you get to learn something from us each and every day. So before we went on that break, I told you we've talked about stigma, we've talked a little bit about treatment and support systems. So now, Griffin, back to you now. There's the aspect of dual stigma, where one is related to the virus and the other one is related to mental health. So how then do we make sure that we combat this effectively?
Thank you. That's a good one, and I think the whole world right now is actually working towards how to combat the mental health, especially among the people living with HIV. Yeah, this is a double-edged sword, I'll say. But again, most often than not, people living with HIV, they need support system. That's why it's important to have the support groups. And the reason for this support group purely just counseling, trying to understand how they are, they are faring on. It's actually on a monthly basis. So between a month and a month, of course, there are issues that are going through. Because most of the people who have who live with the virus, you realize some of them have issues with food. Sometimes not really because lack of food, but the medicine, the side effect of those medicines that the body does not, the body reacts against food, the body reacts against other medicine, and you see now this person is in a quagmire, whether to continue taking the medicine or not. Others, their body reacts. The body, the body swells. It changes the skin, becomes browner or something. So all those kind of some of the issues that affect these people living with the virus. However, the support groups are supposed to just to be a place where you are able to, support each other in terms of what has been happening for the past 1 month. How have you been? Have you been taking medicine? Have you encountered any problem? Do you still have medicine, or you ran out of medicine? Who is supporting you? Because again, you need someone to talk to you, to encourage you, keep taking the medicine. There's life after this. Now, if you don't do that, then of course the mental health issues come in. Because first of all, you start feeling that you don't matter anymore. You start feeling that you're not worth living. And even how people treat you around, you feel like you're not worth living. Therefore, that one brings in a lot of anxiety, a lot of, and of course, for instance, if you take medicine and the body rejects, that means then you need to go for professional advice again. Either you change the line. You have 3 regimes: first regime, second, and third. So if first regime refuses, then of course they recommend second regime. And if the second regime refuses, they recommend third regime. And of course, depending on what happens in between, should it food, is it stress, are you stressed, are there other things that have affect your mind? Because again, if you're stressed out actually, the body will react against the medicine. Then of course, the immune system will start having issues because you're inviting opportunistic diseases, which make your immune system very weak. Exactly. So there are all those in the ecosystem of the body builds in a spirit, a system of mental health issues. We're now that where we need now to have a counselor. In fact, I would prefer to have a counselor or a psychologist to now be the one providing these services, because initially we use HTS counselors, which I think to me, they're not really the best people to provide the counseling services to these clients. I would prefer a specialized counselor who understands the mind, understands the relation between the mind, the psyche, and the body, so that from there they're able to provide vivid and real solutions to mental health, as well as link them to more services.
Interesting. So we have the aspect of regular mental health screening.
That's right.
Should it be considered as for lack of a better word, should it be considered as standard care for persons living with HIV and AIDS? And how then can we make sure that, it contributes to the general well-being of these patients?
Well, actually, screening is one of the best things, and it should be the first step towards identifying if someone has issues with mental health.
Yeah.
For instance, in fact, that's one of the, I'll say it also contribute to, misdiagnosis.
Yeah.
Yeah, because mental health exhibits in different tenets. We have anxiety disorder, we have post-traumatic disorder, we have mental health, we have stress disorder, we have psychosis, we have all those depression, and one leads to the other. If one is not taken care of, it leads to the other, like that. But I would prefer when you are screened, then it gives you an opportunity to get the real medication, to really get the real diagnosis. Because you probably be struggling with the stress or anxiety disorder. Someone is giving, you're being diagnosed with a different medicine or post-traumatic stress disorder, which actually, even instead of providing a solution, you're actually adding severe to the problem. So actually screening is one of the, it should be there too, because it will give vivid solutions to a client who is struggling with a given condition. Then that would be a spot on, because this stress, and this is the remedy to stress. This depression, and this is the remedy to depression. This is anxiety disorder, and this is a remedy to disorder. These are psychosis, and this is how we need to handle it. Because you realize when a person exhibits depression, goes into depression, probably has been using substance. And therefore, once you diagnose, you'll be able to know if you're providing a solution to the depression, or you're providing a solution to the substance abuse, or you want to provide the two at the same time. So it helps to diagnose the right medication, as well as also help to identify what really is the problem to the patient.
So let's now talk about the challenges that comes with helping people with this too. So what are some of the barriers that you'd say are there, especially for individuals who are living with HIV and AIDS and they're trying to access mental health services in hospitals? And how then can we make sure that these kind of barriers are done away with, to make sure that they're in a way safer space?
Well, I would say unlike other illness, when I have a headache, I'll tell you I've had a headache. Easily, I've had a headache. If I have a diarrhea, I'll tell you yes, I feel a diarrhea. Mental health, you never know. It does not write in its face that I'm mentally sick. It's a silent killer. So you see, one of the best way to address such is actually providing friendly services at the facility. As well as I said, we go back to the community. Locally, we need to localize. Right now, if I ask you what's mental health, someone will tell me is walking without naked, working with things, looking like a mad person, but that's not mental health. Mental health is just lack of, being psychological, and in terms of you're not psychologically at peace, you're mentally disturbed because of many competing issues in your brain, all those things, and which actually at the end of the day, if you're not addressed, then they manifest in physical body of a person. You feel weak, you feel fatigued, you feel all those kind of things. So one of the best way to tackle this, actually to address this, provide youth-friendly services to the community. And these youth-friendly services can be put in a way that you have an office within a facility where a youth not feel stigmatized, will not feel pushed to come and seek services. But in case, instead, you feel free to pass by and just say, I'm just passing by to see what's happening here. Then, of course, the person asks you, how are you feeling? Are you okay psychologically? How are you? And just that question alone will make you this person open up and say, actually, I've been fine, or last week this was happening. And through that kind of engagement, youth will actually find it friendly to bring other youth
to bring in other things.
Exactly.
Interesting. So as we slowly come to the end of today's episode, what are some of the ways that healthcare providers could actually implement trauma-informed care just to better address the mental health needs of individuals who are affected by HIV?
Well, one, I'll say we need to have, I know mental health and HIV and specialists, they are very few. You'll find, of course, there's a needed ratio and the existing ratio. Of course, the existing ratio is not able to address this. But I would say one of the best way health facilities can address such, one is to have an in-house mental health specialist. Even if it's one, so that at least we'll find that one in a ratio of population maybe 500 to 1,000, 1,500. Is able, at least is a residence, because right now, they are big business. For you to get a mental health service, you must book. You will actually book. Understand? You actually book and probably not be seen that very day. You actually book for an appointment, then you'll be told, come on a Tuesday. And what if this person was in a verge of killing himself? You see, you lose that person.
Exactly.
Second, we need to, as I said, localize. Which language are you talking about mental health? Localize this aspect, because each county and each community has different understanding of what mental health is. So once you localize it by use of the words that people understand about mental health, then you'll accept. You'll not find it, will not stigmatize yourself, but you'll actually accept that, yes, I need it. When we quote series of events that are happening in your lives, someone will understand. But if you tell someone you have a mental health because you are behaving this, someone might not understand. But once we actually talk about the events, or we cite those events that are happening in the community as a result of mental health disorders, then people see the essence of coming. Of course, subsidize. The government should subsidize the fee. I think the least fee for mental health is, I think, 2,000. And running all the way to 10,000, depending on the person, depending on the economic state of one, and therefore we need to localize to subsidize the fee, so that at least people see the essence and are free to come up for the services freely, as well as provide the real services that people need to get.
So as counselors or as therapists, how then do you make sure that these services are made accessible to each and every person who needs them?
Thank you in fact, you answered another question, making them accessible. Making this service accessible to the people. One is to move, to have, we can say we can have mobile services to the community.
Yes.
Let us not wait for the people to get sick so they come for us. We treat them. But we can now say we are going to the community. Let's do a lot of sensitization. Let us do a lot of outreaches. Let us go to the field and visit. Let's do home visit and field visit. To just tell the people how they, because you realize before it becomes an issue that needs a psychiatrist or a psychologist, it's an issue that a counselor can handle. It's an issue that can be handled within least means, and this person gets supported. So we need to go to the field. We don't need to wait for this person to be sick, so that is brought so that we charge him or her a lot of money. We need to do a lot of sensitization. We need a lot of mental health awareness, a lot of advocacy. Of course, we will agree with me that in 2019, the former president, Uhuru Kenyatta, he actually declared mental health emergency issue, isn't it? In 2019. And there's some modicum of steps that we are seeing, baby steps that we are seeing towards mental health awareness. The other day we saw Nairobi County implementing the mental health strategy plan, just to help to have at least a blueprint on how to handle mental health. Equally, we realize at workplace. That's where a lot of mental health issues happen. We need government should actually allow such workplaces and employers actually to have such a setup within the employment, because employees get stressed. And they're being stressed within that environment, and they're going to stay in that environment. They don't leave there to go home and complain, then the following day they're back.
They come back.
Exactly. And then so we continue. So the vicious cycle continues. So we need to have mental health facilities within those spaces, so they're able to provide solution to employees and employers.
Okay, so my final question would be, we have gaps that are still there. So maybe just talk to us about these gaps, and how would you say that advocacy has increased or improved efforts in contributing to filling these gaps?
Well, I would say one, which is very critical, unlike mental health, other illness, they're being championed. You talk about maternal health on the forefront, talk about malaria on the forefront, talk about NCDs, non-communicable disease among the old people and people. But no, mental health, it has not gained that momentum where it's also being recognized. Maybe right now, this generation, now at least now mental is also being recognized as an issue in the community. Now that's where now we're actually coming out to passing bills and acts to come and support provision of service provision for mental health. So you realize the government has been reluctant to consider mental health as part of the other illness that are affecting people. So at the moment, I prefer the government, this baby step movements. At least now mental health is taking momentum as well as other diseases that are affecting people. Equally, lack of data. Like now, if someone asks you global statistics, we don't have even global statistics. They just say it's not a clear cut. They will say 3 people out of this are suffering. Look, based on 2019 statistics globally, they said 1 in 8 people, at least in one way or another, he has gone through mental health issues. Currently in Kenya, 1 out of 5. You see, so lack of data might not help the government to come up with strategy and intervention to handle mental health, and that's actually one of the big gap, because it's only through data collection, analysis of that data, and actually coming out with interventions to be able to provide vivid solution to what's happening. Equally, the number of specialists in mental health, I may say there are many or not many, but the ratio of psychologists or professional mental health and client, it's very, very low. That's why you realize, even in Kenya, how many government institutions are there that provide mental health? Just whereby you can come, other than the Dr. Njengas in Westlands, and a few private providers. But really the government is just mental health at Mathare, which is actually dealing with the psychiatrist. Others in Gilgil actually dealing with psychiatrists, others in Mombasa. You see, so far we don't have that space where someone, the same way someone who is expectant, he knows when my time is due, I'll go to Mama Ngina, Mama Lucy, I'll go to Kenyatta. Mental health, we do have that space whereby at least if I have issues that I'm really supported, I need really talk to someone that I can go to government hospital or government facility and get supported. Instead, I look to a private facility, a private or independent organization. And maybe now I'll talk about the partners, like World Vision. They're going to provide this kind of services. We have the Red Cross, on a pro bono basis, free of charge. But again, the government should actually partner and support such initiative so that these services can also go to the community at the grassroots level. At the grassroots level.
Yes, guys. My take home would be, love your neighbor as you love yourself. Any other person. This is something that could find you. This is something that unaweza lala leo kama hauna, but tomorrow when you wake up, umetumia a needle or umejikata, and you end up getting yourself, unajipata uko nayo. So just like you'd love yourself, just like you'd protect yourself, protect the next person. Ensure that each and every day you wake up, create a safer space for persons living with HIV and AIDS, because at the end of the day, these are our friends, our sisters, our family, our parents, but ukiendelea ku behave the way you're behaving, is it really good? if tables were turned and that was your position and other people were treating you that way, would you feel the same? Is that love? So at the end of the day, make sure that you love yourself, you love your neighbor as you love yourself, and you're creating a safe space for each and every person who's living with HIV and AIDS. What would be your parting shot?
I'll say, truthfully speaking, there's no health without mental health.
Yeah.
Therefore, let's look for services for mental health by actually taking care of ourselves. And that I'll say, self-care. I preach self-care. Start with yourself, then look for the next person. Because someone who is mentally unstable or who is suffering from mental health disorder cannot give the community around him peace.
Yeah.
So one person who's struggling with mental health affect the whole community.
Yeah.
So let's emphasize on self-care and let the community support this person who has issues with mental health.
Yes.
Because it still come back to you and the community.
Okay,
Yeah.
thank you so much for coming. Thank you for creating time for us.
I'm grateful.
We look forward to meeting you on yet another episode.
Asante sana.
Okay, so guys, with that we have explored the relationship between HIV and AIDS and mental health. We've looked at stigma, we've looked at treatments, we've looked at support groups. So it's upon you. In case you're joining us now, umekuja kama tuko karibu kumaliza, make sure that you go back and start from the beginning, just so you get to learn something from today's episode. And until we meet next week, my name is Lavin Nyagoa, and this has been Counting the Red Ribbons. Get informed on what is happening in our political scenes and people who are making headlines in different parts of the country and the world right here at TAS TV. Join me, Lavin Nyagoa, as I bring to you weekly news highlights that are factual every Friday at 4 o'clock. See you then.